Hello all, we've got a question from a subscriber. So let's see what the question is today.
Hi sir, the question is the patient has done root canal and he's had a crown 2 years back. So 2 years back it's fallen down and he's not replaced the crown. So he's asking whether it can be replaced now again after 2 years.
Okay. Hello. So let's repeat the question. So the subscriber is saying he had a root canal done with a crown being made, and the crown subsequently fell off. But it's been almost 2 years since the crown has fallen down, right? So the question is, can he get a crown done now? So that's a question. So let's look at that particular answer for that particular question here. This is Dr. Arun from Dentistry, running dental centers at Chennai, Raja, Namalipuram since year 2001. If you have not yet subscribed to our channel, please do subscribe to our channel. We've got a whole bunch of videos on dental health and awareness. So it's very important first is you get a crown done after a root canal. There's no doubts about it. But let's try to analyze it. Now he's saying that he has got a crown done and has fallen off. So first we need to understand why the crown can come off in the first place. Number one reason can be the short clinical crown. What it means is the tooth structure that was remaining after the root canal is very small. Because it is very small, the crown that was made was not even though it was fitting well, because of constant chewing forces, it was not holding on to the tooth for a long time, and it has come off. This is one common reason why the crown can come off. The second reason can be the crown fitting of the crown to the tooth structure was not good in the first place. Because it was not fitting well to the tooth structure, the cement that was holding on to the crown eventually gave away, and then the crown had come off. Third reason can be some other decay or something that has happened under the crown, or the space between the tooth and the crown has caused the cement to wear off, and then the crown has come off. So we should first understand the reason why the crown has come off, so that when we make a new crown or check the tooth whether it can take a new crown, so that the new crown which we make is going to last for many more years. So now the next part of the question is, it's 2 years since it has happened. So what we need to check is, we need to check how the integrity of the tooth structure is. Take an X-ray, see how the root canal is, whether there is any infection or anything, whether any new decay that has happened in the tooth structure, whether the adjacent tooth has moved, the upper tooth has come down. Understand how much of tooth preparation that needs to be done to take a new crown. If everything is favorable, yes, of course we can make a new crown having all these three things which I said, right? One, make the clinical crown height sufficient for it to hold the crown well. Ensure there is proper fitting between the crown and the underlying tooth structure, and there are no gaps between the crown and the gums. Of course, at Dentistry we use a digital method. We use CEREC to accurately capture the tooth structure, and then we do a CAD/CAM milling of the crown. So because then the fit is great, and usually the crown lasts for many years. I hope this answers your question. If there are any other questions, please do ask in the comment section below. Until next time, this is Dr. Arun from Dentistry. Bye bye and thank you.